Welcome to the National Association of Health Unit Coordinators Virtual Library. NAHUC is a professional association for health unit coordinators and other frontline healthcare professionals performing similar tasks. NAHUC is the provider of professional development for healthcare support team members. NAHUC is pleased to offer the webinar, The Preceptor Role as a Health Unit Coordinator, as presented by Lauren Fisher and Sarah Gordon from East Tennessee Children's Hospital in Knoxville. We are grateful to Lauren and Sarah for providing this content. This presentation first debuted at NAHUC's Education Conference in August 2023. Information about earning NAHUC contact hours through NAHUC's virtual library can be found at the end of this presentation and on the NAHUC website, www.nahuc.org.
I would now like to introduce our session speakers, Lauren Fisher and Sarah Gordon. Lauren is a clinical onboarding and workforce development coordinator at East Tennessee Children's Hospital. She is responsible for the coordination of nurse programs, organization-wide development and execution of nurse residency, externs, and preceptor workshop programs. Lauren is also involved in many volunteer activities, including runs for hematology and oncology at ETCH and the Girl Scouts of America. Sarah is an accredited education specialist and NCPD primary nurse planner at ETCH. She develops, implements, and evaluates nursing continuation professional development activities, ensures compliance with accrediting bodies, with nursing leadership to meet organizational needs and strategies, priorities, and is part of a lead team that is responsible for organization preceptor education program. Sarah is also a member of the Association of Nursing Professional Development. Please give a warm welcome to Lauren and Sarah.
Can you hear me? Can you hear me, Travis? Okay.
Yeah, are we good? Okay. Yeah, these aren't our favorites, but we
Yeah.
do what Travis tells us to do.
Exactly.
So
Well, hello, everybody. Hello. Everybody get a good lunch? Okay. Try not to
no
get in
falling
a food coma.
Yeah, no falling asleep on us.
Okay, so Sarah and I are going to present about our preceptor workshop that we do, and it's house-wide for all employees, clinical and non-clinical. And so we're going to give you a few of our, kind of a shortened version of a few of our topics that we do in the preceptor workshop. So precepting is what we call training new employees. So any part of the onboarding process, a lot of the time we call these people who are training the new employees preceptors. So you may hear that. So I asked when being asked to present here, I was especially happy to do that because not only have I worked with Denise for a few years in the ODL department, but also as a nurse and clinical leader on a unit where she was the HUC. So I've learned a lot about her. So I'm very excited to kind of brag on her a little bit. So I always joked that when I was there and I was in charge, Denise was in charge because she knew all. So when asked to do this presentation, I asked around our organization, what word comes to mind when you think of the word, your HUC? Can you see that on there? Oh, it's cut off. But these are the words that I got from our fellow employees. The glue is my favorite one right here. They're the glue of your unit. You're organized, essential, a resource, knowledgeable, advantageous, conducive, fun. Who likes to have fun where they work? And visionary. I got those words and I thought that fit perfectly for the HUCs that I know here. So I just wanted to share that with you guys. So facts about onboarding. It takes a village. It takes everybody to train a new employee, not just the person or the role they're training to, but it takes all departments, different roles, education levels. And it takes a hospital to run, or it takes all these types of people to run a hospital and to take care of patients. So we want to recognize that you are a big part of this village, and your role in training a new HUC or a new employee is very crucial. So facts about training new employees: you are a major part of your organization's onboarding team. Did you know that? Yeah, a big part, right? You are training that new employee. These are some facts. 69% of employees with a great onboarding experience will likely stay with their employer for at least 3 years. So that's important to make a good impression. Most new employees decide whether they'll stay with the organization within the first 6 months, sometimes even on day one. They'll say, yes, this is a great fit, or no, this is not a great fit. So onboarding, the good onboarding experience increases retention, employee satisfaction, and decreases errors, which is very important in healthcare. So as a whole, we can do better. As of January 2023, the national hospital turnover rate was 25.9%. So we know that, healthcare, it's hard to keep people in these roles. We are going through what's called the Great Resignation, where we're seeing lots of turnover. This just shows that we have room for improvement, and you guys can be a big part of that. Okay, so the preceptor role, you get to wear many hats, right? So we have educator, role model, protector, evaluator, and socializer. So I have these words around the room here, and I want you guys to take a few minutes and go to one or two of these stations. I've got markers kind of spread out, and write down a word or a phrase that what you think that word means. So evaluator, what does that mean to you? So take some time, get up and stretch your legs, and kind of write on these sheets of paper what these words mean to you.
We thought after lunch we needed to get y'all up and
some
moving.
exercise.
Yeah. So don't be afraid.
Yes.
Get up, pick one that you see, and just start writing some words down.
Got markers around the room. Ooh, ouch, the ER. Okay, I'm going to start over here in this corner under role model and read some of these. These are all great. Integrity. Is that important as a role model to have integrity in the work that you're doing and the job you're performing? A positive vibe. I like that a lot. Nobody wants to come to work and not have a positive vibe. You're responsible, a leader, an example, humble, another leader, follow my lead. Go-to person, motivating colleague to grow. I love that. We promote growth with ourselves and with our colleagues. Share your experiences. I think that's really important to kind of show where you came from, your mistakes, and what you've learned from them. And take responsibility. I love those. Evaluator, mentor, lots of dittos on that one. Mentorship is very important. Honesty, feedback, thinker, performance, assess their learning. That's very important. What's the point in training them if we're not going to assess what they've learned? Was the task completed if not given guidance? That's a good perspective. Observe, giving care, understanding feedback, supporting. Good job. All right. And I'm going to go to educator. We've got the teacher on that certain role, right? Or many other roles you may be doing at once. A subject matter expert. Yes, you are, right, Denise, HUC?
Yes.
Multitasker. I think that's the biggest thing. The biggest part of being HUC is that multitasking. That is not for everybody. Problem solver experience, the turn to person. I love being that. That's almost like the mentor. I love being that person for somebody. Understanding their way of learning, correcting when it's appropriate. That's very important as an educator and another leader. I like that. Sarah, you want to take these?
All right, so I'm going to take protector. Someone put take under wing, shield from rude behavior. We know that that can happen. Another shield, brave, justice, comfort others when things go wrong. Everyone makes mistakes. Yeah, we definitely know that happens, and that can really take a toll on us when we make a mistake. I'm here for you, encouragement, feedback, being a welcoming person that people can comfortably come to for help. Let's see, advocate for the unit, patients and families, giving guidance when asked, ensuring staff family safety. Those are all really great things as a protector. And then back here we have socializer, connecting new employee with others on the team. That to me is exactly what the role of a socializer is. Introduces to all unit employees, keeping in touch, the liaison to staff, families, and patients, interact outside of work environment. That's a good one. I like that, especially for someone who's brand new, who maybe doesn't have any other connections outside of work. Life of the party, fun person. All right. Maybe with some boundaries around that, but yeah, that could be good. So we'll come back a little bit more to this role too later. After Lauren talks, we'll be talking more about socialization. So all great things.
So yes, as you can tell, you're going to wear many hats when you train a new employee, and it's just like you have to multitask in your role. You have to multitask as a preceptor. So that's important just to kind of consider all of these things. When you have a new employee, it's very important just to welcome them, get acquainted. Sarah is going to talk a little bit about that socialization. Greet that new employee at orientation if you can. If you can stop in that day that they start or when they're getting checked in on your unit, reach out. One thing our department does really well is sends an email before they start saying, we're so glad you're part of the team. And maybe they don't see it until day 1 or 2, but they still have that when they're opening their email. Ask them questions, get to know them. It's important to kind of, we're here to be professional, but to also get to know them on a personal level. And then help familiarize them with the organization and all the nitty gritty of whether you work in a big or small organization, there's still a lot to learn. And it's also important, we'll talk about feedback and setting boundaries and goals later, but discuss their expectations of what it can look like as they're on orientation, both in the organization as expectations that your organization has and as your role, and set those goals together. That's very important. So they're not surprised by, you didn't meet that goal. Well, I didn't know about it. So it's important to know all those things. So just take those little minutes or seconds to send an email or to say hi or welcome them to your unit. That's really going to help them feel part of a new place and feel better about being onboarded here. So Sarah, you can take over.
All right, so we're going to get into a little bit more specifics about orienting a new employee and how you can do that successfully and what role you play as a preceptor. So we're going to talk about learning styles, but before we get into the specifics of that, I want us to think a little bit about the things that impact the way we learn. Okay, so I have a few questions for you. The first one, in general, does age matter in the workplace? Just give me. No. Okay, so we have a lot of yeses. Okay, but if you think about it maybe from the HR perspective, age typically cannot matter. You cannot hire someone who's older just because they're older. You cannot hire someone who's younger because you think that you'll be able to pay them less. So age, sometimes you can't really look at, but maybe other times it does play a role. So we'll get into that more. What about life experience? In general, does that matter in the workplace? Okay. Again, I think this is one of those yes and no things. So if I'm 25 years old and I'm a unit tech and I work with a 60-year-old who's also a unit tech, does that 60-year-old, does that mean they're automatically going to be a better unit tech because they've had more life experience? Not necessarily. Okay. But what about when you're training a new employee? Do you need to take into consideration age and life experience?
Yes.
Yeah, that's when it does become a really important thing to consider. So these are just some comments. Maybe some of you have heard comments like this before. Maybe you've said them before even. I mean, we get into these mindsets that, you know, how do I motivate a new employee who doesn't want to learn something new? Or they come in here thinking they already know everything. Or they think the way we do things is old and outdated, and where they came from, they did it way better. We've all had these thoughts that can impact how we train people. We all have biases that can impact how we train people. So just keep that in mind as we move forward. Think about the times that maybe you've had some thoughts like this and how that maybe has resulted in not the best outcome when you've had to teach a new employee, or maybe you've had thoughts and been able to work through them and you've had a great result training a new employee. Okay, generational differences in the workplace. We have right now in the workplace a huge span of generations, and that affects greatly how new employees come in and learn, and it also affects how you as the person training them is going to teach them and orient them. So this is just some data that shows you right now in the workforce generally what the percentage of people are, like where they fall in certain generations. Don't get too hung up on the years that are showing here. You can look up several different websites and it's going to give you a few different year ranges. But in general, you can see that right now in the workplace, Generation X and millennials are dominating our workplace. Okay, we still have quite a few baby boomers that are also in the workplace. So if you're comfortable, don't feel like you have to raise your hand, only if you're comfortable. How many of you in here are millennials? Okay, Generation X. And how about baby boomers? And anybody else that falls out of either of those ranges? Traditionalists or Generation Z? Thank you for representing. Yay. Okay. We are about to have a ton of Generation Z in the workplace. We're right on that bubble right now where Generation Zs are starting to come out of college and come into the workplace, or come out of high school even and come into the workplace. So it's interesting to see the big spread. So again, we don't have enough time to really dig into all the details about different generations, but just keep in mind what you are and how that may impact the way you train somebody. And knowing that if you're training somebody who's in a different generation than you, how that may impact the way they learn. So here we have traditionalists and baby boomers listed up here. Typically, generational buckets are determined by world events. So when you think about what people have experienced in certain generations, like baby boomers, for example, they experienced the Vietnam War. That was one of the biggest things that were part of the baby boomer era. But then you get into millennials, and we're the 9/11 group. So that's a huge world event that has shaped our generation. I'm saying our because I'm a millennial. So there's just a few fun facts on here that tell you different things about different generations. One of the biggest things to remember is that how someone learns, how they're motivated, what they look for in an employer is very much led by what generation they've come from. Now, generations are not black and white, so there will be some people that maybe identify more with millennials, but they're a Gen Z. So you can't live in this black and white world. You have to know that it is a little fluid, but big picture is that generations do impact how you teach and orient as a preceptor. Okay, so how we learn. Do you all have a learning preference? Yeah, you can right off the bat think about, this is how I like to learn. Okay, does it ever change? Does it depend on the situation? Okay, I'm one of those. Like, it depends on the situation and how I want to learn. Sometimes I want to watch something, sometimes I want to do it. Okay, so we really cannot get into all the different learning styles, theories, models that are out there. If you Google learning styles, theories, models, even personality styles, learning theories, all that, you will come up with a list of a ton of different models. And here I've listed a bunch of them, but ultimately you would be an information overload. One I do have on here is DISC, D-I-S-C, and you'll see that again tomorrow. So you will get to dig in a little bit into a specific model. But for today's purposes, what we just want to recognize is that the way someone learns is important. And you have to know as a preceptor, not only how you learn, but also how the person you're training learns. So when you get a new employee, you need to take the time to ask them, maybe your employer, maybe your organization during orientation does some kind of a learning model identifier. Maybe they take a quiz, maybe they do something even in the pre-employment that helps identify how they learn. So use that to your advantage, because it's only going to make it easier for you to teach new employees if you understand their learning preferences. What I'm showing you up here is one of the most traditional basic learning models that we often gravitate towards. It's the, do you learn by seeing something, like reading it? Do you learn by hearing it? Do you learn by touching, feeling, practicing? So this is just kind of an example of one of those models. But the takeaway is to be adaptable. As preceptors, you're going to drift towards your typical preference, but that may not be in the best interest of the new employee. So just be flexible, be adaptable. Isn't that what ambiguity, we gotta be agile. So some takeaways specifically for learning styles. Generational differences do matter. Take the time to know what generation you've come from, what motivates you as an employee. And be respectful of someone coming from another generation. Us millennials, we've gotten a bad rap over the years. So just be understanding and maybe not quick to judge about people in different generations. And then it's super important to be adaptable to different learning styles. Okay, so we're just doing the down and dirty right now with the topic of generations and learning styles. So we're going to shift gears and we are going to move into workplace socialization. For some people, this makes you want to crawl into a hole, because you would consider yourself more of an introvert. And so thinking about having to socialize may make you uncomfortable or wish that was not part of what you had to do. But I promise you can be introverted and still help socialize a new employee to their role. Okay. Socializing does not mean you have to take them out, you have to party, you have to plan some big lunch event. That's not what we're saying when we say to help socialize a new employee. Okay. But it is one of your roles to help integrate them into the workplace environment. Okay. So I love this. I do feel like nurses really resonate with this, but I think other places can. Nurses often have the thing that the older nurses eat their younger nurses, and it's like some rite of passage or something. But yes, we need to remember that our new employees are our friends. They are not food. So we need to be kind to them, hide our sharp teeth. Okay, so we often think that certain tasks, certain things are not our responsibility. I'm doing what I'm supposed to do to orient this new employee. I'm teaching them the ABCs of how to be a health unit coordinator. And we just want to say someone else can handle the fluff and, the warm and fuzzy stuff, like let's be a kumbaya unit. But ultimately, we cannot push off those responsibilities to other people. If you are an assigned preceptor, if this is your person that you are acclimating to the unit or to your area, your department, then you need to own that. So I love this saying. Hopefully I can read it and not trip up over it. Okay. There was an important job to be done, and everybody was sure that somebody would do it. Anybody could have done it, but nobody did it. Somebody got angry about that because it was everybody's job. Everybody thought anybody could do it, but nobody realized that everybody wouldn't do it. It ended up that everybody blamed somebody when nobody did what anybody could have.
Correct.
Just sit on that for a second. So please be that anybody. Don't be the nobody. Okay. Take these people under your wings. Socializing them can even be just the two of you going to lunch, or maybe on the first day, if you know you're going to be their preceptor, be at the beginning of orientation, and as they walk in the door, figure out how you can just quickly connect and say hi. How many of you this morning, there were several of us standing outside when the buses got here, and we were saying, good morning, welcome. How'd that make y'all feel?
Good.
Tell me good. Don't tell me that you didn't care that we were out there, right? Yeah. Okay. And how simple was that? And you were brand new to this place. You had no clue what to expect today, but something that simple hopefully started your day off right. You can do that as preceptors. Okay. So workplace socialization. This is one way you can look at it. Is it happening in 3 phases? And each phase is equally important. So you have the getting in phase. This is before the new employee even starts. This is, think back to when you were a new employee, first day, maybe even first couple, before you even went to work, the first few days before your first day. Were you excited? Were you nervous? Were you hoping this was going to be the best job ever? Were you hoping that this was going to be where you landed for the long haul? So the getting in phase is all about that anticipatory socialization. And that part does land more on the new employee. You as a preceptor can influence this stage by doing what Lauren mentioned, where she said before a new employee even starts, our director, who's sitting over there, lovely Miss Susan, gives us the email address of the new employee and says, hey, send them a welcome email. So that could be something that could impact the getting in phase for a new employee, because day one, before they even know who the people are they're working with, they're getting emails saying welcome. Then the breaking in phase, that's known as the encounter stage. It occurs in the first few weeks when people are here. And this is how people first start to experience the culture of the organization. Do you think this stage is crucial?
Yes.
Do you think it can impact someone's perception for the long haul?
Yes.
And as a preceptor, do you think you have a big part in this stage?
Yes.
All right, I agree. Settling in. So this is when an employee starts to identify themselves with the organization. They start to determine what their commitment to the organization is going to be. So this could happen during the orientation phase with a new employee. It could also happen after orientation, or it could continue after orientation. Do you think this phase is still important as a preceptor?
Yes.
Even after orientation is ended and your job as the preceptor is done, do you still think you have the ability to impact the settling in phase?
Yes.
Absolutely. You are going to be that one person, hopefully, that new employee really trusts. And so even after orientation is over, they may turn to you and look for guidance when things are getting hard, or when they're confused about how they've interpreted the culture of the organization. Okay, so all 3 phases, you have the potential to impact. The question that should resonate with you, leaving today, leaving tomorrow, when you're on the airplane going back home and you're rethinking about what happened at the conference, when you think back to the presentation about being a preceptor, ask yourself this question: what will your preceptor legacy be? How you orient and train a new employee is part of your legacy. So be the preceptor that people are going to say, I heard she's awesome. You have the best preceptor in the building. You are Denise. All right, so things to remember: take ownership for socializing your new employees and leave a good legacy. Okay. All right, big shift here. I'm just rolling right along and I got to see how I'm doing. I'm actually a little ahead. Okay, are we doing good? Everybody's hanging with me? We're not like fading because of food comas, right? Okay. All right. Conflict management. Dun, dun, dun. What causes conflict in the workplace? So I have several options here. What do y'all think? A, B, C,
All of the above.
D, all of the above.
We have physicians for that.
Okay, so I'm hearing, the couple things I've heard focus on D. So if I asked out of all of these, A through E, which one typically rises to the top, even if all of them impact conflict or can contribute to conflict, what do you think rises to the top the majority of the time? Communication, yes. Okay. Do we all think, let's see if I can get this.
Go on that one, no, I'd say people too.
Okay, do we all think we're good communicators? I'm an awesome communicator. Right? Right, team?
Yeah.
Maybe I paid them to say that. I don't know. Yeah, thanks, Travis. Travis works right outside my office, or like so he can have no comment. But we all think or want to think that we are good at communicating. I'm sure she would look at how proud she is of herself. She thinks she's a good communicator. Okay, but sometimes are we not as good as we think we are?
Yes. It's good between husband and wife.
Oh, you think that's a husband and wife, not a coworker? Okay.
Wait.
Okay, yeah. Okay, disclaimer, this is not acceptable behavior in the workplace, and I really don't condone it at home between husbands and wives either, but that's your space, so, you know. Yeah, so we often want to believe that we can communicate well, you know, that's something we want to do well. We have that inside. Nobody wants to be bad communicators. No one wants to take that or own that, but we do need to own that we do sometimes have room for improvement as communicators, right? And so we don't always get it right. And that's okay that we don't always get it right. All right, so we have an activity for you. I have my lovely helpers over here that are going to be passing some things out. Before they hand things out, you guys are going to have to determine a role you're going to play. You can stay seated right where you are, but you need to partner up. Everybody needs a partner. Okay. So if you need to move a little bit to find a partner, you're going to have to partner up. Now, the important thing about partnering up, somebody has to identify as the role of the preceptor. Somebody has to play the role as the new employee. Okay. So they see where to go. While they're passing it out, I'm going to explain the rules of this activity.
I've already lost.
Okay. Don't turn over your papers until I tell you to. If you are the preceptor, so right now you have your hand wide open, right? If you're the preceptor, whatever is on your paper, you are going to describe that to your new employee, but your new employee cannot see what is on your paper. Okay? You are going to describe what is on your paper to your new employee. If you are the new employee, so you had your hand up with the fist closed. If you are the new employee, you're going to take your blank piece of paper and you are going to draw what the preceptor is describing to you. All right. Preceptors, you cannot look at what your new employee is drawing. Okay. You both have to, in essence, kind of be blind to what the other person is doing. Okay. Finish up with your last instruction. It's okay if you didn't finish. That's okay. Finish with your last instruction.
from one end to the other. The shape of a rectangle.
All right. Okay. If everybody can pause. Now, if you haven't shared your papers, go ahead and share. See how close you got to each other. Yeah. Okay, who is looking at their papers and going, yeah, that was good? Who's like, that was really good? All right. Okay, who's looking at their papers going, oh, yikes? Who's having a oh, yikes moment? Okay, we are going to do some reflection. Okay. Okay, let's all come back up here and we're going to do some reflection from that activity. Okay, so I would like some people to answer some of these questions. So who would like to answer? What was the most challenging part of that activity? Go ahead.
Trying to describe the shapes and the sizes.
Okay.
Point where she could get it exactly how I'm showing on the paper.
Okay. Did you use measurements like 1.5 inches or did you use more like 2 fingers or what did you use? Measurement. Who else used measurement like 1.5 inches or okay. Okay. Who used, so that's more of like an exact kind of measurement. Who used something different to describe the size? Yeah.
So like with the long box to the left, I said like the length of the paper.
Okay. Okay. What about you?
Road signs.
Road signs?
Interstate and yield signs.
Okay. Okay. Clever. What else was really challenging?
I think going a little off kilter here. I think it was difficult because of the distractions.
Distractions?
People were doing the same thing at the same time. It was hard to hear.
Yeah. So we do that. Lauren and I do this activity every time we have a preceptor course. Y'all are the largest group we've ever done this with. So this was definitely the loudest it's ever been. And I promise I didn't plant him, but that was an amazing observation that you just made. So he said there were a lot of distractions. So that was challenging for him and maybe for some other people, that there was a lot of background noise. And so does that happen in your workplaces?
Yes.
Yeah. That's a big thing, right? There's distractions all the time. Okay. Who had the harder role? Did the preceptor or the new employee in this activity? Okay, I'm hearing both. Yeah.
Both had equally challenging. Yeah. But the challenges were different.
Okay. Yeah. Okay. That's very observant. I love that. Okay. What do you think you could have done differently now that you've figured out what we did? Looking back, what would you have done differently on either side as the new employee or the preceptor? Would somebody have done something different?
Listen to the whole description of the shape before I started drawing.
Okay, that is super honest. Do we have new employees who are just so excited and gung-ho that they just go for it before you've even finished explaining what to do? Okay. And on the flip side, are you sometimes a preceptor who's just so excited that you're just rattling off this, do this next, then this, and you forget that this person next to you probably is seeing stars because you are jumping way ahead? Okay. How do you think this activity relates to conflict? Yes.
Well, obviously, if you're not being able to communicate effectively, they're not getting what they need as the new person. And then you're gonna get more frustrated yourself as a preceptor.
That's right.
I feel like what you're saying should be coming, they should be getting it.
Right. Exactly. Okay. How many of you had to clarify as the preceptor role? If you were the preceptor, how many of you had to clarify what you were describing? So specifically like the shapes that had patterns in them. How many of you had to use different words to describe those patterns? Okay. By any chance, was the first word you used, did your new employee go, what? It has what in it?
Yeah.
Yeah. Okay. So I heard a new one over here. He described one of his boxes as looking like an Excel spreadsheet. Okay. Did you know what he meant when he said it? Okay. In graph paper. Okay. I've had in other classes, I've had someone use the word gingham. And the person that was the new employee was like, what? I don't know what gingham is. What is gingham? Yeah. Okay. So how do you think that relates to being a preceptor with a new employee in the real world?
Generational thing, some of that.
Yeah. And sometimes do we just use words that we know? I know what gingham is, but my new employee might have no clue what I've just said. They don't understand. And some new employees might be brave enough or confident enough to say, wait a minute, you got to say that differently. I don't get what you're saying. Other new employees are not going to have that confidence yet to speak up and say, I'm lost. So as a preceptor, what can you do? What is something you can do to help make sure they're understanding you?
Ask questions, like see where they're at.
Exactly.
Like regurgitate it back to you to make sure they're hearing what you need them to hear.
Exactly. So yeah, go ahead.
Have a little patience, give them time to grow.
Yes. Yes. We were all in their spot once, right?
And Sarah, that was a comment over here that I heard was, and then the next step, oh wait, are you ready? Checking in, and are you ready? Seeing where they were at.
Awesome.
Yeah.
And I think sometimes as preceptors, when you're training a new employee, we can sometimes forget, we think of the new employee as the one that's asking all the questions, right? Because they're new. But we as preceptors have a responsibility to ask questions also. We need to check in. We need to pause. We need to make sure that the words we're using make sense to them. And it's not because they're not smart enough or they don't know what they should know. It's because we all communicate differently. See, I don't even know that I'm communicating correct. I know. Yes.
Anytime that I've had to precept, we typically are extremely busy. So I usually tell the new employee, you're going to be very overwhelmed, and that's okay because that's what you're going to get. But eventually you're going to get one thing at a time, and it's just going to start happening.
And that's great. It's great to help prep them for what to expect. And also, this is where you got to put on all these different hats as a preceptor. As you're teaching them and you're being an educator, you also have to be a protector of all those distractions like you brought up. So if typically you work in a department or a unit where you're used to having people fly up to you and give you 10 different things to do at once, and you're great at keeping that all organized, when you're training a new employee, you might need to protect that new employee, and you might have you need to be the one that takes on the responsibility and tells people, wait a minute, I am training a new employee. I cannot take on all this that's flying at me right now. We need to slow down, or you need to come back in a little bit. Okay. Yes.
Now, we precepted somebody, and so I had a book. And explaining to, step by step, and I didn't overwhelm them like somebody else would say, I need such a thing. I would give them a sticky note and say, write it down on there, and then I'll get to the ones that's more important instead of overwhelming them new employees. That's how I had a book, and I just passed it on to the next person.
That's an awesome suggestion. I love that. And you know what these conferences are great for? You can talk to one another and share best practices. So, yeah.
You didn't hear that.
Oh, yeah. So she said that she keeps a book to help her new employee learn from. And like when people fly up to her with things they need done or need help with, she asks them to put it on a Post-it note, and she keeps those Post-it notes and prioritizes them so she can continue to teach the new employee, but also stay on top of your everyday responsibilities as a health unit coordinator. And that's a challenge too, precepting and still being able to do all the things you're responsible to do every day. That I just want to recognize that it is hard to be a preceptor. Okay. It's not fun every day either. And it's okay to feel that way. Yes.
So I really don't like being a preceptor.
That's okay. That's okay. Yeah, I don't think you're alone.
Particular girl, she just did not get it.
So I think you did all the right things, though. That's going to happen. Sometimes you're going to get employees that maybe weren't the best hires, and that's not on you. You know, you didn't hire them, you didn't make that decision, but sometimes you're going to get someone that maybe it doesn't look like they're going to make it too long, or you may just get someone that isn't the right fit with you. And that's okay. That doesn't make you a bad health unit coordinator. That doesn't make you a bad teacher, but it could just mean that there might be someone else that can jive with their style a little bit better. And so you did the right thing. You went to your management, you went to your educator, and that's the best you can do. You reflected on how you were teaching her. And I think if you do all those things, if you try not to just have a blaming attitude where you're just blaming it all on her, which it doesn't sound like you did, you reflected, you took action to try to resolve the conflict that you ended up in. I love the conversation we're having, and this is what thrills me. I would love to keep having the conversation, but I don't want to take it. Lauren will get mad at me if I take her time. Look at how I just did that. I blamed. That was blaming right there. Okay, so I am going to run through some more of this. And if we do have more time at the end, let's continue. I would love to continue the conversation. And I know you had something to say, and I hate it when people have something to say, but okay, let me just run through a lot of this. So conflict is going to happen, and you described that perfectly. You're going to run into conflict in the workplace, especially as a preceptor. So what do we do about conflict? Sometimes conflict isn't necessarily about the resolution. You know, the saying, it's, not about the destination, it's about the journey. So when conflict comes up, we have to think about how do we work towards an outcome that maybe isn't a perfect resolution, but it's something productive. So that outcome doesn't have to necessarily be negative or a total waste of time. You can still work through conflict and end up with something, with a positive outcome and something that's productive, except for that situation. Hopefully the positive outcome is that she has found a better calling for herself, and we can all move on and know that we're not having to rely on her to do our work. So Thomas Kilman, this is an evidence-based model for conflict management. So Thomas Kilman is a model you can follow to help give you some guidance on how to resolve conflict. Y'all have a handout in front of you. It's got all kinds of colors on it that we passed out. I've put on the top of that handout is another version of this breakdown of the different styles for managing conflict. In this particular model, there are 5 styles for managing conflict. Some of these, when you read them, you might think, oh goodness, one of these styles or a couple of these styles are good and some of these styles are bad. Like when I first learned about this model, I'd think, well, I definitely don't want to be the competing style. That sounds negative and bad. And I don't want to be the avoiding style either, because that makes me seem weak and I don't want to be avoiding conflict. Although sometimes I'd rather hide in a closet than deal with conflict. In truth, all these styles are appropriate and have their time and place. So none of these styles of management are bad. They just have the right time to be used. Okay. On your handout, there's a little bit more description about what each style means. Here I have another image that shows how these styles work. And for sake of time, I'm not going to get into it too in depth, but you do have a QR code, the first QR code on that handout where it says Thomas Kilman mode instrument. What is it? Questionnaire. Yes. You can scan that QR code and it will pull up a PDF, and you can take the quiz that's in that PDF, and it will tell you where you most like to fall when you resolve conflict. Okay. Then it will also go into each of these categories and describe different times that they are good to utilize and when one's better than the other. So use that as some ongoing professional development for yourselves, since today we don't have time to go into that. It's really good to know yourself and how you tend to fall when it comes to resolving conflict. And then maybe think about some situations where some of the other areas could be helpful as a preceptor. So when it comes to precepting, we're going to kind of wrap this section up. We want to be aware of how we communicate and adjust as needed. So think back to that activity that we all just did, the drawing activity. Think about how you communicated, what could have been helped you do a better job with that. And then remember, conflict will happen. It doesn't mean you've done something wrong. It doesn't mean you're a bad preceptor. What's really important is how you manage it. That is your responsibility as a preceptor, to role model positive conflict management. And then hopefully you will be bringing up newbies that also will be better at managing conflict when they face it as employees. Okay? Man, I wish I had more time, because I could really, like, we're cramming in a lot that we do in our preceptor course into like a little bucket. But y'all are great. I love chatting with y'all. Okay. I took up enough of your time.
Fine. Okay, so I'm going to talk a little bit more about feedback. And you kind of mentioned that. How do you give feedback to these new employees, good or bad, right? You can tell them they're great, keep going, well done, but you need to be more specific in feedback for them to really feel like they're doing a good job, or for them to even make a change when needed. So what kind of feedback do you guys do in your organizations? Checklists on orientation? Yeah, the dreaded checklists. Electronic, does anybody do checklists electronically? Oh, please, I would love to do that. Paper forms, all that stuff. And that's like, whenever you say, would you want a precept? That's what a lot of people think of. Oh, I don't want to do all that paperwork. It's extra work. So, well, I'm going to talk a little bit about why it's important and why we need to do it for feedback. And this is really about this evaluator hat. You know, some people, like conflict, don't like to give that feedback. It's uncomfortable sometimes. So we have a few tools that might help. So we have what we call a collaborative partnering guide, and I'm going to show you a picture of it on the next slide, but then I also have copies if you want to take a copy of this home. But it asks questions: what's important to me in a professional working relationship? How do I prefer to communicate and make decisions? What are my strengths as a new employee? How do I handle conflict, challenging situations, and expectations for how we communicate to each other in this new relationship? So this is what it looks like. Like I said, I think I put the copies over here, and I'm happy to email anybody a copy. But this is just something you can give them if you don't feel comfortable asking this new person, this new stranger, essentially, how you feel about all these things. It's good to hand it to them, give them a few days to kind of fill that out. So then you know how to, if a conflict does arrive, you know how to manage that with them, or how they appreciate that feedback. What's important to me, how you communicate, make decisions in different areas, how to make your preceptor new employee relationship more effective. This is just great. So you can refer this. People say they make packets and notebooks and stuff. I think this is a great addition to that. So some feedback tips quickly. We want to focus on the behavior at hand and not the person in general when we give feedback. You want to give immediate feedback, so you can be specific as possible when appropriate. You don't want to give feedback in front of a whole group, a whole nurses station of people or doctors, or something that will embarrass them. But make sure you pull them aside or give quiet feedback as soon as possible. Make it specific, not just, hey, you did a great job today. Name something, one good thing that they did a great job at. For example, maybe, hey, you did a really good job at referencing that policy when it comes to the transfers, whatever it may be. Oh, here we go.
Oh, they're getting weather.
Thunderstorms obviously are happening. Woo, that's a little, yeah, and it's very windy. I see that. Yeah, if you guys feel like you need to get up, that's okay too. We'll finish this up. And then work together to create actionable goals. So say you got through week 1 of your new employees training. Let's take some time at the end of that shift, the end of your day, to say, hey, what do you want to accomplish this next week? Here's some things I think are appropriate for your week 2. What are things that you want to see? And make those goals together and then review them each week. That can help give them some satisfaction and make sure that they're staying on track of their orientation timeline. Obviously, this is impossible in healthcare and in your roles, trying to teach too much at once. It's going to happen, but just try to be cognizant of that and just say, you know what? This is something new as well. We may have to come back to this, loop back around to it. It is very impossible to not try to teach too much. There's so much information. Just be cognizant of it. Ensure that you have talked about every kind of improvement that's needed. If you are filling out evaluation forms for your managers to see, make sure that whatever's on that form, they are aware of themselves, this new employee is aware of that. It doesn't need to be a surprise to them. Make sure you're having those difficult conversations. Don't avoid the feedback. That doesn't do anybody any good. It doesn't do you any good as a preceptor. You're training a new coworker. This person will be your coworker. So you want to have great coworkers. And then try not to only give corrective feedback, throw in those good wins that, hey, great job with that difficult physician over there, or thank you for taking care of that family member, anything like that. Throw in those positive wins too. Reviewing the work, that's important. Anything they're documenting, you want to make sure that you are responsible and reviewing those interactions. You're doing those checklists, all that good stuff. It's important to listen, encourage support, celebrate those wins, promote that self-care, even in yourself. I know that's really hard. Okay, so a few scenarios before we wrap it up. And you guys, if you've been in one of these situations or you have some feedback for me, just shout it out. You have a coworker that you're training where poor communication resulted in a mistake. What are your steps as a preceptor? What can you do?
I typically say, okay, so we made a mistake, but that's okay. We can fix it.
Okay.
Let me show you how you fix it.
Uh-huh.
And then let me show you how to do it right.
Okay. I like that. She said, that's okay. We made a mistake. That happens. You know, let's see how we can fix it for the next time. And let's do it the right way. The coworker you're training is frequently on their cell phone. This sounds very familiar. Scrolling through social media or texting. You have noticed them on their phone while you're trying to train them, and also in front of customers, parents, families, patients, during their interactions. What do you do?
This never happens, right?
No.
Never.
No, my first thing is I really put on my boss in a sense and let them know that this is not what is expected. You know, I understand we have personal things that we need to do.
Right.
But if, you know, management comes around, there will be consequences and everything. So, you know, we need to really kind of monitor that and try and just pull back to what we're doing.
Perfect.
They're doing something else.
Right.
Just try and pull back. Oh, look at this is what we need to go on to next.
Right.
Pulling back. I don't try and correct the behavior by in a negative way.
Right.
Pull it differently.
To redirect. Okay.
So we're living in a different world.
Uh-huh.
So cell phones are a tool.
Sometimes, yes.
So we talk about a notebook.
Uh-huh.
Your cell phone can become your notebook.
Yes.
You can write on.
Mm-hmm. Mm-hmm.
I think we need to think about what the tool's being used for.
Exactly.
We do anything, but I think those of us that used paper and pencil have to recognize paper and pencil looks different today.
Exactly. So yeah, let's ask some questions. Let's say, hey, is there something personal you need to take care of? Or and then she might say, no, I'm taking notes. Well, that's great. Just say, make sure you're paying attention to the patient that's asking you a question, or the physician, or whoever's coming up to you for requesting anything. Or maybe they really are just not paying attention. You know, I like how you said, you know, this is part of our policy that we're not on our phone for social. You know, if you need to take a personal call, you can step in the break room for a minute, maybe take that personal call, because we all have things going on. Kids are going back to school. We're worried about them. That's what we talked about this morning.
This is one of those generational differences that for some of us is really hard to accept as being different, you know, and that doesn't make us bad if we're the type that's like, no, we don't need our cell phones at work. You know, we don't need that. We have everything we need right here. It's hard if that is what you're used to, and to shift and have a different mindset, but we do have to reflect on that and recognize that in some cases, they are using, new employees of a younger generation are using it as a tool, and that is okay in some circumstances. So to be accepting of that, we may have to change ourselves as the preceptor and remember that.
And to
Like
go.
personal phone calls.
Yeah.
You know,
That's different. Yeah. Make sure you're seeing like, what are they using that tool for? Like she said, is it for work? Is it for personal use?
And you need to remember that we took a generation that did not have computers for charting to a generation that only charts on computers now.
Yes.
So some of us transcribed orders and did all of that. Now that's all changed. So our generation that you didn't do that, not my generation, the generation that didn't do that, they have to learn how to use the new tool. You know, those notebooks with those Apple pens,
Yeah.
those are really cool.
She's loving it. All right. I like all those answers. Okay, so you have a fellow coworker and that's bad mouthing another department. It's not your new employee, but it's another coworker, and they're making comments in front of the new employee that you're training. How do you stop that? Yes, ma'am.
One thing you can do is kind of just redirect the conversation.
Exactly. That's good. Instead of like reprimanding, right?
Let's talk about this.
Yeah.
Sometimes, especially being at the hub desk, like I always kind of tell people, like, we're kind of like always on stage.
Yeah.
Not only the staff here that.
Exactly.
Sometimes just kind of lightly saying it, but not necessarily like reprimanding them.
Right. You're the role model in that. Yeah.
Redirecting it to something.
Right. I like that. Yes, ma'am.
It also sets like their first impression of that, either a coworker or another department. It's that first impression for them rather than allowing them to have their own first.
Right. And we want to promote the collaboration and the teamwork, right? We are like that village we talked about. You got to get everybody on the same page.
When going off of that, I try and stress them when I've had that happen in different things, different opinions, we have different work ethic, different things in that. I don't want to give you my perception of someone.
Yeah.
Or don't take their perception of that one. Really just wait until
make your own.
Your action might just be just fine. You don't have those.
Right. Maybe they caught that person on a bad day. Yeah. Yeah. I like all those. Great. All right. A patient's family member has complained about the orienting employees' interaction at the nurses station and has reported that they didn't listen to their concerns about their child or their patient. We deal with children here. So maybe it's their parents' care. What steps do you take as a preceptor in correcting that? That's hard too, because you have to stand up for you got to be that protector, but you also have to be that role model. Yes, ma'am.
First thing you have to say to the patient's family or whoever you're dealing with says, I hear your concern.
Love it.
To start with that.
I hear you.
Set the tone with that. And don't throw them under the bus and like, oh, she's new and she doesn't.
Right. They don't usually work over here. They're from a different department. Yeah.
She's my preceptor.
Oh, yay.
Years ago. So I learned.
Look at that relationship right there.
I love it. And I'm not a very technological millennial either.
Neither.
So it worked out with us. But I think too, like watching her deal with the conversation, I kept my mouth shut, let her talk, watch the interaction, and then I was able to mimic that behavior in an appropriate way.
Yeah, I love that.
Now I do the same thing. So generationally, it's doing that way.
Yes, I love that. And I did the same thing with one of my managers. When I worked over there, he was so great with conflict. So that terrified me. I would just go with him anytime he was going to go deal with that. And I would just listen, see how he talked to people. He sat down, went face to face, took the time. That's a really good point, just to kind of observe and then model that behavior too. And also maybe what the family's saying is not true. You can't say that. You just want to listen to them, listen to their side, listen to your preceptee side.
Board for the family.
Right.
Buddy.
Right. Yeah. You want to just hear both sides and determine what needs the next steps. Not everything you have to deal with, discipline or anything. That's something you just take up to the next level. You take up to your management team.
Yeah.
Okay. So we have a new coworker and they're doing so great. All right, at this point in orientation has come up with new ideas and processes for your department to work more efficiently. So how do you give positive feedback?
You're doing a great job.
Okay, you're gonna tell the preceptor they're doing a great job? What, how else?
The manager.
You're gonna tell your manager that your preceptees, okay?
Or educator.
Educator. Your educator? Right. Some people love that praise. That might be something else you find on that collaborating guide, partnership guide. They love the praise. Some people cringe at the thought of being recognized in public. So you just have to feel that out. You know, they may want to say, you may want to be in a huddle and say, look at this new process that she came up with. How amazing is this? Let's try it out and see how it works. Or they may just like an email, you know, a private email. So you just have to kind of feel out how they like that praise, but always recognize those little wins. Okay. All right. You're training a new HUC and a nurse asks them to page a physician. 20 minutes later, the nurse asks them to page the physician again. Policy states that the provider has 30 minutes to call back. So they're hounding you. What do you do?
Call everybody. The intern.
Okay.
The fellow and the attending on the phone. I'm not.
No policy for you? Okay. Anybody else? I'm not a policy follower either. Yes, ma'am.
The 30 minutes to call back.
I've had that and, you know, because I do know that this provider has 30 minutes to I let her know, hey, I heard you.
I heard you.
We got 15.
Blah, blah.
Yeah.
She's satisfied, but I'm still not gonna call him back and page him again for 30 minutes.
Yeah.
I'm still gonna get.
So you might they may not know the policy. They may just be all like, you know.
We can let them know what.
Yeah. Educate them on the policy. Say, hey, according to this and this, they've got 30 minutes and here's where I paged them at 20 minutes ago.
Let them know I'll follow up.
I think always recognizing too, like their concern or their sense of urgency. If you say, hey, you're doing a great job by being concerned for this patient, and I wish this doctor would call back, but I have to follow this policy. But I understand you're staying on top of it and you just want the best for this patient. So I think if you recognize why they're wanting you to call again, that sometimes helps them take it down a notch or two.
Explaining it just a little bit.
And when you're tell the Huck, when you're paging that doctor for the first time, tell me, and you're writing on your paper here that you paged Dr. Fred at 20, you know, this time.
There's a timestamp.
When they come up to you, say, like, it's been this long.
Yeah, there's a timestamp. There's a documentation, right? I love it. Yes. All right. So just a few last minute tips. Check yourself, you know, like not everybody loves to train new employees, or maybe you just don't love the new employee that you're training. That's okay. But always make them feel welcome. Try not to give them the impression that you would rather them not be there today. We want to make sure, you know, this is going to help you in the long run, help your department, your unit. Welcome questions, and just be mindful of your body language. This girl usually like rolls her eyes in the back of her head, but she also is like side eyeing right now. So just make sure you're having a positive smile on your face and welcoming them. Keep your commitment. So if you tell your new orientee, your new coworker that we're going to do this task tomorrow or in the next few days, make sure you keep those commitments. That builds trust between you guys. Take a time out if you need to. You know, I know there's typically only one of you in your department, so you may not always have a moment to take that time to say, you know, I can't train somebody, but you can ask for help and resources. And you don't know all the answers, even though you probably do in your departments. I know Denise does. If you don't know the answer, use your resources. Use your charge nurses. Use your policies. Whatever employee internet stuff you guys have. Use those resources. And if you don't know, just say, "Hey, I don't know, but I'm going to go find out for you." That will earn you a lot of respect. So, like we said, we're not perfect. We're not going to train everybody the right way every single time, but that's when we can learn. When we make mistakes, we can learn the most. Use it to recharge, make some changes, reevaluate how we're training people. And healthcare is changing every day. New processes, new computer systems, new paging systems. We have to learn to accept and embrace those changes, even though we may not want to show, maybe we not feel it inside. But as a role model and a preceptor, we need to make sure that we're changing with the ever-changing world of healthcare. Any questions, comments?
NAHUC's virtual lending library. To earn NAHUC contact hours, visit https://nahuc.org/ and look for the Education tab. Click on NAHUC's virtual library to access the post-test and instructions on how to submit the post-test to earn NAHUC contact hours. Email the NAHUC office at office@nahuc.org or call or text 815-633-4351 with any questions. Thank you for viewing this presentation.